Good morning, everyone. Thank you for attending the Healthicity Auditing presentation, Enhancing Your Audit Plan with an External Audit. My name is Justin Larson, and I'll be our facilitator today. A couple of items to mention before we begin. Today's webinar will be about 45 minutes, then followed by a Q&A session. Your line is muted, so if you have any questions, please send them via the questions box, or feel free to email your questions after the presentation. Please note there will not be any CEUs for today's webinar. Also, you will receive a link to the recording of this webinar later today by email, as well as a link to download the presentation deck. Our presenter today is Layman Willis. Layman is a healthcare professional with more than 20 years of experience in hospital and physician revenue cycle, practice management, compliance, coding, billing, and client services. He has been providing healthcare consulting and solution services to hospitals and physician organizations throughout the country. With that said, I'll turn the time over to Layman.
Thank you, Justin. We're glad to have you here on the webinar today. As we get started, let me just point out what we're going to be talking about from our agenda as we think about external audit. And so the first thing we're going to be discussing has to do with the benefits and best practices of external audits from an external auditing vendor. We'll look at some case studies, and we'll talk about easy steps to enhance your audit program through external audits themselves. So the first thing we're going to be going over is benefits and best practices of external audits. One of the first things that you'll want to consider is what is going to be the best thing to do as far as what are the benefits for outsourcing your audit services. You'll have to assess any of your internal operations to think about the strengths and weaknesses that you might uncover and see if you can actually provide this service internally, how far you can go with that. If there are areas within the organization that you need to supplement this based upon your staffing ratio, the skill set that your auditing staff may have, and the time and availability based upon their workload, then these are some of the things that you'll need to think about as you determine the points of need for outsourcing your audit services themselves. So the first thing is allocating resources. You have to invest in resources to monitor, assess, and measure the performance of auditing services and the quality of what's going on. And so, for example, in our organization and what we're doing in providing audit services to clients around the country is, we get a lot of phone calls from practices that are being audited and they end up owing a tremendous amount of money. Oftentimes this happens due to mistakes, things that coders don't understand or things their auditors are missing, and so those particular things go unchecked. And so you need to find out if your auditing staff and or your external auditing agency is doing a good job or not. If you're a larger organization, you probably have some type of audit quality committee, or if you're a smaller organization, you've appointed individuals who are tasked with monitoring your quality of your coding. Some of the next thing is, do you have written policies and procedures which establish what your audit standards and guidelines and corrective actions will be? As it relates to auditors, someone has to be tasked with the responsibility of overseeing corrective actions. All of your auditors and any type of external auditing agency would be subject to, review. And so you want to make sure that you conduct performance reviews on a regular basis, right? And so, that's going to be looking at, meaningful elements for the quality reviews and assessing what that periodic timetable is going to look like itself. So in avoiding some of the resource issues that you'll be thinking about, one of the things you want to do is not necessarily allocate all of your resources towards conducting audits and post-audit education activities. Um, there are audits that can be conducted by qualified and competent staff if you have them, of course. And if you fail to monitor your quality, then of course you're asking for, you're simply asking for trouble. And so, for example, our organization had a provider who called us. This was several years ago. They were being audited, and the payer was telling them that they owed, as much as $100,000 in overpaid claims. And so our organization did a review, immediately picked up on an issue, and said, yes, the insurance company is correct. It was an honest mistake. It was something that a trained auditor would have picked up on right away, but their coding staff, they were the people who were doing the audits. They were not qualified, and they never took the time to get an outside opinion, which would have caught the issue. And that's, that goes back to one of the things about the need for having someone else take a look at what you're doing. Even if you probably are doing audits internally, it's always a good idea to have someone else take another look. Another set of eyes is very helpful. And so that brings us to, our next point, which is, outsourcing the audits for educational purposes, keeping education internal, but outsourcing your audits. What happens if your organization has limited resources that aren't being allocated this way? One of the things that you'll want to think about is the growing trends of outsourcing audit works to a third-party organization. There are several benefits to this because you can get validation, you have independent review. Oftentimes your auditors internally can feel pressured by the providers within the organization, and that can oftentimes be more cost effective if you're outsourcing your audit services. The organization can keep their auditors and have them focus on post-audit training and follow-up. You can also stagger your projects appropriately this way as well, and at the same time not have to compromise any of your compliance standards. And so we commonly see organizations will try and lower their standards a lot of times, and maybe they will only conduct reviews every other year, or they'll lower their pass rates for any type of re-auditing or remedial training, or they lower their sample size to possibly 5 records per provider instead of really a basic minimum would be 10. And so those are really dangerous tactics. And then they're not a lot of times utilizing and leveraging technology that is available to them. One of the things to think about also is that the OIG recommends that external and external audit is something that is part of the ongoing monitoring and maintenance as one of the core elements of an effective compliance plan. There are 7 elements in the recommendations for an effective compliance plan, and that's actually listed under number 5, which has to do with auditing, monitoring, and quality. And so, these are just things that you'll want to think about if you're working with limited resources themselves. Okay. And next is simply investing in compliance. You need to access to current coding materials, whether that's books on the desk or it's online use of books, good reference materials. Your auditors need to be appropriately trained and proficient in the use of any tools that they're utilizing, and then you have to have appropriate staffing ratios for that. And so, the recommended auditor to provider ratio, you wouldn't want to exceed, 1 per 100 providers, right? And so that can vary based upon the scope and frequency of your audits and your organization size, and of course the compliance program requirements that you might have based upon what's going on with your organization. But again, just relaying another instance, that instance of providers calling in and mentioning things to us about overpayments, we again have seen that in the same way, in that organizations are understaffed in what they're actually trying to do with their audit program itself. Leveraging software, that is something you can't ever take that for granted any longer, because software is going to help you improve your accuracy, your quality, and your efficiency. Auditing tools out there can help provide that. It can have a meaningful impact in your organization. And so, we always recommend that leverage technology wherever you can. Choose qualified auditing staff or external auditing agencies. Make sure they're qualified. Some of the qualifications you'll want to think about is going to be related to a list like this. Are they credentialed professionals that are qualified and have advanced training as well as audit experience? Your auditors should be evaluated to ensure that they're qualified to review claims in the practice's specialties. You need to have some type of skills test that you administer before you hire or allow someone to do auditing. And so ideally, auditors would probably need to have a minimum of, say, 3 years of experience in auditing itself. And so if you're using an outside auditing agency, you'll want to make sure that those same criteria are followed by whoever you utilize. You should verify their credentials before hiring them, before contracting with that organization. So common mistakes that we see organizations make is having auditors conduct audits in areas that they have little familiarity with and they're not very experienced with. They think that because they're a coder or they've been doing coding for a while, that they're particularly good. They could be good at auditing, and so they're kind of put to the mix there. Also one of the common mistakes we see is not testing their skills in advance and just assigning and trusting them that they know what they're doing. But again, regulations actually require you to check your auditors against state and federal exclusion databases annually. You want to make sure that people are not on the OIG's exclusion list, for example, because if they are and they're working for you and you doing business with Medicare, Medicaid, or any other government payer, you're going to be in some type of trouble because they're not allowed to do business with them. All right, and continuing on that theme then is, having staff that are chosen again based upon their competency, that they've demonstrated this competency by applicable certifications. They have skills that have been evaluated and they performed audits before, and you've determined that those were good audits, that they can be held up to scrutiny. And that you assign these to those who match the experience and expertise of the specialty that they're going to be reviewing. Again, checking them against any type of exclusion lists. All right, so now let's just quickly go over a case study, and this is about ineffective third-party audits. So what happens when you disagree? What happens when you disagree with either your internal or your external auditing organization? So for example, a consulting company is hired to go on site to provide coding audit for an oncology practice. They reviewed about 100 cases, some that were E&M, some chemo administration services, and the findings demonstrated mostly accurate E&M services and diagnosis assignments. There were a few random errors, but nothing that was really systemic. The coding for the chemo administration, though, was mostly inaccurate. Okay, and so that is a big problem when it comes to chemo for many, many reasons. Obviously, one would be, when you're in error, you're losing money. You're also possibly in error making more money than what you deserve based upon if you receive payment or not. And so one or the other is happening, and you're out of boundaries in your compliance as a result. And so people did not have a good handle on this. All right, so exit interviews, have to be conducted to find solutions when things like this occur. Consulting with the practice administrator, the consulting company's executive auditing staff, clinical staff who are responsible for knowing about the coding, like the chemo RNs, the billing manager. These are individuals that have to be brought into the mix of the audit services themselves to make sure that everyone is on the same page. Revenue manager and RNs were certain that the audit findings were incorrect in this account. And so the audit executives remained calm. They demonstrated unwavering certainty in identifying these incorrect coding of the chemo services that we're talking about. And so they outlined correct code selections for the cases in question, including the official guidance from both the CPT guidelines and also from CMS. And when that was done, they stood by those results. The correct coding resulted in lower reimbursement in this case. But upon arrival at the home office, our consulting person, they received emails requesting additional summaries and findings with resources cited for any of those recommended coding changes. Those were provided with the full citations, the coding principles, the guidance, because as we know, chemotherapy services have a hierarchy, just like the infusion therapy services have a hierarchy. There's a hierarchy that has to be followed in order to provide those. So months later, after all that occurred, the company's audit work papers, findings, reports were subpoenaed as part of a fraud investigation. And the executive ran into the practice administrator at conference, learned that the practice had declined to implement any of the suggested changes. The administrator had left that practice because of that, and the investigation is still ongoing. So it continues, right, as a result of that, because of the errors that took place in the coding and failure to properly audit that. So now here's a different case study that has to do with effective third-party audits, and when you have agreement and see some good results from it. So some of the challenges that are seen are going to be things to do with understaffing key resources. This particular organization was not adequately staffed with auditors and educators. Their compliance program required annual audits, but they were not getting completed post-audit follow-up, and that was almost never done. And if you asked the providers how they scored on their last audit, they didn't know, and they said that no one had given them any feedback as a result. Everyone was being managed on a spreadsheet. Everything was being managed on a spreadsheet, wasn't being kept current, wasn't up to date. They were keeping track of new providers. They were trying to do that, but it was a real challenge. They had no baseline audits that were being conducted. And so audits were being done on a simple audit document, no real report of findings, no meaningful recommendations were put on the reports. The reports were rarely provided back to the providers, if at all. And so the scope of the audits were often being dictated by the revenue cycle department, who were trying to identify areas of revenue, and they were not focused on compliance. They were trying to make money. And so most of their auditors were coders, and they were not trained in auditing. They were not skilled at providing good feedback to their providers at all. And so after they brought in a third party for audit review, a baseline audit was provided, finding that only 65% of the services were correct, and that another 25% were overcoded and at compliance risk, 10% were undercoded. Moving on into the second quarter review, we see that it changed a little bit from 80% and 15 overcoded, 5 undercoded. Again, the third quarter review, corrections continue and increase more to 87%. You see the numbers there. And then fourth quarter, we're moving in the right direction up into the 90 percentile to be, as high as possible on that curve there that we need to be. So the impact there, you'll see, is that the compliance risk that is associated with that monetarily represents about $26 million. And then the missed revenue represents about $5.8 million as a result of the audit services that were being provided to them. So moving forward then in that fourth quarter, because of the changes in the incorrect information, the overcoding, the undercoding, that was brought down significantly so that the compliance risk only represented 3.7 million, the missed revenue only represented 2.3. And so again, with continued improvement, continued enhancements in the processes, the policies and the procedures, the feedback to the staff, the utilization of technology, all of those type of things, you can see that you're headed in the right direction. You're bringing yourself more in alignment to be able to have exactly what you need in your organization when you're talking about quality and improvement in your coding processes. All right, so what did they improve to get to this place? Okay, what did they do? So the first thing they knew was that there was a lot of work to get done in fixing many of those issues that they had, but because this was going to take time, they outsourced their audits, and that improved immediately their audit reporting and auditor skill set, right? Because they didn't have some of that internally. They started working on improving their internal audit capabilities, though, at the same time. They staffed up their resources so that their auditors that they had were not overwhelmed with work. They put a pre-hire screening process in place to evaluate their auditor skill sets. They assigned auditors based on specialties that had skills in the specialty areas they needed them in. They kept those areas with expertise, over for our audit organization. And then they looked into ways that they could revise their audit reports. They wanted the reports to have summaries of results that could be easily understood. They wanted a summary of issues that were found and any corrective actions that needed to be taken, so there would be recommendations related to that. One of the other things they did was adopt an intensive training program where any of their providers that were less than 90% in their accuracy had to receive one-on-one post-audit training and then a re-audit each month until they got to the 90% and above accuracy. And next, they required that all their providers receive their reports and were reviewed with the auditor, and they were signed off on. And so in conducting those audits, it was important because it helped to identify the deficiencies that needed to be addressed at an individual level. But the secret to their success was the focused training and education efforts, and that was something that was ongoing, and it needed to be ongoing itself. All right, so next we're going to talk about simply preparing, getting ready for audit itself using an external audit organization. And so one of the things that you'll have to do is, talk about clear goals and help ensure audit feedback is on target with your organization's objectives. Setting goals gives whoever is in charge in the organization, whether in the hospital setting it's the HIM director, or in the physician organization it's the practice manager, a coding manager, whoever that might be, whatever their title might be, they need to have meaningful recommendations instead of binders full of all kind of unnecessary reports, things that really work. Some of those staff will have specific goals or organizational challenges that actually drive the audit itself, and then others have a predefined area for audit based on internal quality reviews, findings, staffing changes, any upcoming initiatives based on what's going on in the industry, such as RAC audits and things like that. So some of the things that have to happen are just relaying that information, those expectations, to all of your staff members and allowing them to have time to go over that, to peruse it, to have feedback related to it, so that everybody understands what's happening, what's going on, and is on the same page. Next is simply knowing that coding management often uses those audits to determine baseline, right? So we need to know where we are from the very beginning. So audits are for that purpose as well. You've got to have a starting point. And so a specialty-focused audit enhances that. It helps bring perspective and consistency to your staff. Those with limited experience, it points out some needs for more training and education for them, right? That's a good thing. That's not a bad thing. And so it helps to ensure that the knowledge that they're developing, is there, that they're getting growth in their career, in their job. And one of the other things about setting expectations has to do with supporting the project, right? In past audits, that have shown increased improvement, the way to decrease those errors and increase revenue and productivity is much easier to obtain support again when you were able to show that, when you're able to point that out, that you had decrease in errors, increase in revenue and productivity. So the audit projects provide that type of support for upper management and can promote that on an ongoing way for those needs. The past audit data helps to produce that in a fluid way, so you can have whatever it might be, like graphs and charts, statistics. You can show the improvement in compliance specs, and also monetarily with any type of data that you would look at that way as well. Also, with setting expectations, it helps to do that so that you can alleviate any stress for the audit itself, for your staff, right? And so you communicate that information with your staff. You talk about the benefits and the opportunities with them. It allows them to get their head around that. It also serves as an educational opportunity for them when you present it this way, that it's supposed to be something that is a positive thing for education, compliance, to enhance your revenue. And then having those results be a confirmation of the need for any training and education, so that you can help them to improve in their function and improve the organization as a whole. Part of that as well is emphasizing that perfection is not the goal here, but accuracy, completeness, the compliance, revenue will follow as a result of doing those things. Never worry about the cash. If you're doing things correctly and appropriately, the cash will follow. Incorporating those things into the expectations for those coders in their employment evaluation then provides the necessary benchmark for how you'll go about any type of corrective actions in the future, right? And so you also need to have, though, a fair appeals process when they don't agree with something that the auditing agency has found or the auditor has found. Then you need to have some type of appeals process so that everybody can come to a fair arrangement when there's disagreement that you can't come to with them, right? And so those are some of the things that by setting expectations you can overcome these areas of stress. Also letting people know, how the records are going to be pulled, allowing people to provide some input related to that. In the hospital setting, you're going to be talking about both inpatient and outpatient services, so you'll be dealing with all types of things related to a mix of data, such as DRG information, case mix information, things that are going to require further investigation, probably with clinical staff as well. In the physician organization, we're talking about a whole different set of things, but still, coding staff need to be brought into the mix there. Dealing with and setting expectations about the risk and what the audit goals are, the specialty focus needs that you have, and any type of random mix that there might be. And so all of those things help to set the expectations so that everyone knows what's going on, what is occurring. Okay, next we're going to talk about managing the audit itself and dealing with that external auditing agency. And so there needs to be an understanding of what the policies and procedures are, right? What are those policies and procedures? What is going to be the place of access? How are the staff going to be able to get into the EMR? What are the deadlines? All of these things are necessary for your auditing organization that you're utilizing to deal with the guidelines that you have set for your coding staff and your providers, the templates and tip sheets that you would use. How are they going to get that information and utilize that information when they're doing the audit for your organization itself. So all of those things are important to go over with the agency so that the audit process is being managed appropriately. The next thing has to do with any payer-specific policies, right? Your auditing agency won't know that information unless you provide it to them. So the last thing that you want is to have that awkward discussion with them and your coding staff or your providers at the end of the audit and say, oh, by the way, you didn't know this, but this is what our payer requires. So providing that up front alleviates that conversation. It gets that out of the way. Communicating that to those third-party audit vendors is necessary. Them knowing what the error rate policies are that you've been following, and so that they would be able to help you if there's a need to adjust any of that. Those things that do or don't affect changes in things that are going to affect reimbursement, right? Is that going to be considered, that type of error that's going to be something that is focused on so hard as opposed to other services that would be? Next is, what is the reporting methodology going to look like? What is the best type of report for your staff? Is it going to have, all types of colorful graphs and benchmarks? Is it going to have source data in it? What is that going to look like? Are you going to be able to provide that type of information for continued focus? And then, making sure that that third-party audit vendor can meet your scoring methodology, that they understand what you want, how you want it to be, and that you're going through the process that way for those services. So make sure that you're communicating that information to that organization. Next is the process of the feedback, education, and training. Who will provide those results to the coding staff? So you're utilizing an external audit organization. They should have competent staff who can communicate with not only coders, but also your physicians and non-physician practitioners at a level that they will all feel comfortable with. There have to be some type of level of expertise to be able to do that. And then how will they handle challenging personalities, right? We all know that each and every one of us can be challenging to one another when we're passionate about something, we believe we're right, and no one can tell us we're wrong sometimes. So we need to have people who can help educate and train people that can deal with those type of issues when they arise with those personality situations. Okay, next is coordination and communication. And so here, we want to think about from the internal and external point of view with utilizing auditors internally or an external auditing agency. Do they have access to the management or coding staff that they'll need during the process, right? And because you want them to be able to provide you with updates as it relates to the audit. There will need to be frequent updates to allow for better education when the project is completed. And then, any remote auditing helps to be able to update error reporting across the entire spectrum of the project, and it also is possible and practical for everyone involved. And so, those are things to consider and to try to focus on as you're thinking about, providing those individuals access to your management staff. Some of the other things have to do with weekly follow-up communications, having that audit list reviewed so that you know what providers or what coders have been reviewed, You know, are there any access issues that staff are having? They can't get into the system. They're having password problems. You know, is there an IT issue that needs to be discussed with someone? Are there record requests or missing data that needs to be provided to someone? All those type of things are part of the communication process that need to be thought of. And then is there preliminary, excuse me, is there preliminary data that needs to be reviewed? Are there already some things in the form of either graphs or charts, scores that can be looked at ahead of time to determine that you believe that the audit is occurring appropriately, it's happening the way you thought it would, and you're headed in the right direction? Okay, or are there policy discrepancies that need to now be discussed that were, you know, possibly unknown at the beginning? Those are the type of things that you'll want to be thinking about with your communication goals. Okay, and next is the review of those results, right? And so here we're talking about, you know, what the pass rates are. What are your areas of thresholds for how things will be scored? So there's all kind of methods. There's several different methods of scoring things, and those might include the type of scoring that you use for audits that are based on the focus of the audit. So if you're performing, say, a prospective annual audit, then equal weight scoring is a good way for organizations to identify any areas of potential risk and provide education and monitor through a follow-up audit. If you're performing retrospective audits, then you have a potential risk for overpayments for overcoded services, whereas your risk for undercoded services may not apply, and so some groups choose not to count undercoded services as errors in those instances because of that. Weighted average scoring could be used to put emphasis on higher risk areas, and so the rationale is if there's no direct risk, then why count something as an error? And so, for example, overcoded services such as evaluation and management or surgical procedures that have a higher impact than an E&M service that's undercoded by one level, or a diagnosis code that has a wrong fifth digit. You know, those type of things are instances which, you know, a weighting can help. Scoring based on fee schedules and overpayment are often used in payback audits from payers as well as by the OIG. And so, for example, the government has a 5% tolerable error range. And so if you reviewed 10 dates of service, converted the dollars, you could have 2 to 3 errors and be within the 5% range. The OIG uses 95% of dollars from the claim, and so it's common to see 90% or even 80%, but of course the best practice is 95%. And so again, there are all types of different type of methods. You need to determine which one is going to best suit your needs for your particular audit. And next, we want to think about who the stakeholders are going to be involved in the audit review. So, you know, auditors should not just make a stand just to prove they're right. Instead, they need to present recommendations for improvement, suggestions for better quality and compliance. And to that end, you know, you'll want to have, they'll need to have some examples for you, whether it's your internal auditing staff or an external auditing organization that emphasizes those type of things for your, you know, directors, whether it's in the hospital setting for a HIM director or in the physician organization for a coding manager or the practice manager, you know, audit managers, revenue integrity directors, whoever those individuals are, even members of the medical staff or medical directors that would attend any of these meetings as you might have to deal with clinical documentation improvements. All of these people are stakeholders that need to be in some way, shape, or form involved in the audit. And so once reviewing with your team, it may be more focused and come down further to a smaller representation. And so that team of people might be individuals like you would see here or someone similar as far as their title. And so, you know, this helps your auditing staff or your audit agency to be able to maintain, you know, educational and not adversarial postures with your coding staff as you think about, all the different type of people that you'll need to be dealing with and how you'll present some of these findings for review at the end, right? And so, most auditors will present a preliminary finding sheet for each case and review only major trends and significant findings. They might use specific case examples as a way to describe coding irregularities, such as those found between two coders or in comparison to correct coding guidelines. Coders may rebut and return the finding sheets with their own comments following the exit interview in accordance with, whatever your established process might be for that. But, finally, someone at the top, whoever's in charge of the coding, is going to request that the exit interview include that educational component as time permits. And so next we want to think about and talk about the implementation of the results. Okay, and so here's where we think about what type of tools that we'll need to use for that. So tools for corrective action. In the results area, we'll have charts and caseload details. We might have DRG, APC, CPT, ICD findings. There'll be auditor findings, comments, rationales. There's all kinds of different things that are part of the tools that can be utilized for the corrective action plan. There should be trends and benchmarks that were discovered. The auditor's response to those coding appeals. The recommendations for any type of follow-up education, and then any future audit actions that might be recommended as a result of that. The trends and benchmarks are going to be utilized from the standpoint of being able to point out specifically in the corrective action plan what items are going to be tools for use for those coders, for those providers, for the staff and the findings that you have, so that that can be changed, the direction can be changed going forward with those staff members. And then the implementation of this comes down to planning the education with employee sign-off, so everyone knows that they've had the education, they attended, they solidified their understanding of those concepts. The improvement for those things enhances the coding and documentation going forward, and then there's a continuation of monitoring and measuring what has just taken place, right? And so we follow up by, again, doing more audit in the future to determine that those concepts have been understood, everyone is on the same page, and we're all following the same plan that has been designed. And with that said, I've finished, and at this time we'd like to go over and take some questions that we might have. And so Justin, I'll just ask you if we've got some questions in queue already.
All right, Layman, we did have one question from Yolanda. She asks, how can I find out if a company is OIG approved for performing an audit?
Okay, so you won't be able to find out if they're approved. What you would be able to find out if they're excluded. And so what you would want to determine is individuals that would be performing the audit, individuals who are in charge of the organization, individuals who would be providing any education, training, that those individuals' names are not in the OIG's exclusion list, which they publish annually. And so before the audit is performed, you would get a list of those individuals that you're going to be involved with from that organization and compare that against the OIG's list.
All right, and are you seeing any more of those questions over there in your questions panel, Layman?
I don't have any other questions at this time. Let's see, maybe I have one more. Do your audit for payer non-compliance with ERISA? So that's a pretty specific question. I'd probably take that offline and answer that. If you can get the person that came from, I can follow up with them by email. Next question is, oftentimes payer denials violate basic ERISA compliance Do you audit for that? So that's again part of that same question, I think, and I'll take that offline, as I said, to follow up. Another question is there an auditor qualified for dental treatments billed to medical insurance? So that's pretty specific. Yeah, you'll need to determine, what the audit organization that you're going to be utilizing, or the auditing staff you would utilize, have that skill set. There are people out there who have that skill set. There are, there is a need for that, of course, and that information can be audited. So you have to find the organization that can provide that. Now, as for our organization, do we have someone, and do we actually do that? I do not believe that we're involved and have anything that we've done in the dental arena ourselves. Next question is, where does a billing service come into play with the responsibility of their practice coding properly? Could you provide the sample coding template for outpatient department visit or E&M visit? Okay, so that's something pretty specific I would need to take offline to answer by way of email as well. I can just deal with some of the question, though, about the billing organization. So the billing organization is, if they're not doing your coding, they're just simply taking what you have coded already and passing that through. Their responsibility really just has to do with the proper delivery of the data that they've received from you. Now, if they're doing the coding, of course, then that organization is going to be, under your umbrella, and they're going to be looked at as being out of compliance if the coding is wrong. But it always comes back to the provider organization, because the person who actually signs off, so to speak, on the bill, puts their name on the bill, is a physician. It's a physician, or it's a provider in the hospital setting. It's still a physician. There's someone who puts their name on the bill, and ultimately that organization and or that individual or group of individuals is going to be held responsible for that. So what level of education do you need to have to be a consultant? What type of training would you recommend coders have to audit within their own team if it is a coders auditing coders? So again, as I think I mentioned in the presentation here, that probably a basis of 3 years of auditing experience would be necessary. If they're a coder, then they should have already had a couple of years, at least a minimum of a couple of years of coding experience in their industry and in a particular specialty. So for example, if they were doing emergency room coding for E&M services for physicians, and possibly also surgical services in the emergency department as well, then after having coded for a couple of years and then having audited internally for a couple of years, with some training and oversight, possibly taking some other courses for that type of specialty, and how to do audits, then that person would be qualified going forward to do some auditing for you. Okay, let me see if there's another question. Where can you find out how to get certification as a specialty auditor? So AAPC offers some compliance and also auditing services and certifications. We have those type of specialty certifications available, and we can definitely point you in the right direction for those things. And that's, again, something I can also take offline and answer in an email for that individual. Next question is, what is the typical cost of having an external or exterior auditor perform this service on a single practitioner office? How is it determined? What are the ranges of cost? And so in that particular instance, again, that's something I'd take offline to deal with that in an email. I mentioned technology. What type of technology is best suited for records management, coding of the dental treatments billed to medical? Again, that's one I'll take offline to answer by way of email as well, because I'll have to do some research on that dental information. Next is, what if a payer requests coding of a certain type of claim to be done in a way that contradicts correct coding if that shows up in an audit. Okay, so in that instance, what you'll have to have is you'll have to have something written in a written policy format from the payer. And then the person that's going to be doing the audit, obviously, would be either your external auditing organization or maybe your payer is doing the audit. So you have to have that information in writing from the payer. So let's say the payer wants you to use a certain CPT code over a other CPT code which you know to be the correct one, but they have a specific one they want utilized, then that's something you need to get in writing from your payer so that your audit staff and your audit agency knows that information. All right, how can you find specialty software for auditing such as PT, OT, and sleep? There is auditing software available. There are some that have specific information within them that allows for, review of any type of services, depending on, it's all, in this case, it'd be CPT based, CPT code based, as well as for your ICD codes. But there's plenty of different types of software available. Of course, Healthicity has software as well. We can definitely point you in the direction of some software that can help. Okay, is there an auditor certification specific to behavioral health? I don't know of one that's specific to behavioral health, but audit services and audit certification itself simply deals with the capability to really be able to audit, period. Now, the person who is a coder or has experience with behavioral health of some length of time would be that individual who would have a greater propensity to be able to do the auditing of behavioral health. However, there are a lot of routine understanding about how you go about doing audit that comes from knowing those things that are taught and provided in an audit certification itself. All right, how best do you approach supervisors when an audit has been done but no education is ever provided? And this is a contract coding. So in that instance, what you want to just let them know is that, the audit needs to probably have some education opportunities provided so that people can benefit from that. They can gain more understanding. They can learn from any mistakes that they might have made. They can also have the opportunity. You just have to present that to them, discuss that opportunity with them, ask them, why that hasn't been provided in the past. Is that not something, a service that organization or they have thought about, offering possibly? Maybe that hasn't been thought of. So it simply needs to be discussed with them. And so then when using an EHR to code the visit, how do you ensure that the system is coding appropriate levels for the E&M codes? Oh, that's a good question. You have to check it. You have to do some checking of your system there. If your EHR is assigning levels, you need to confirm that the EHR algorithms have been appropriately developed and everything is happening just as you would a human, an individual assigning that information. Have people take a look at it, review it, set it apart as something that you do as part of your audit process and compliance process so that you can know internally that that software is working appropriately. And if it's not, then you need to speak to that with your vendor, with your EHR vendor, so that that can be corrected, that can be updated. There can be something of a fix for that with maybe some type of software update. All right, with that said, I think we'll close off the questions at this time, and Justin, I'm going to turn it back over to you to close us out.
Sounds good, Layman, and thank you. Thank you for the great presentation as well. We do have more questions here. I just want to remind everybody that we are going to get to all of your questions. We'll be doing that through our blog post series that's called the Ask an Auditor series, so be sure to check into our blog post to see those questions, the answers to your questions that you've submitted. You can also get answers to your questions by contacting Layman directly at layman.willis@healththecity.com. And you may have noticed that we do have a quick poll here. We'd like to take a moment to fill out if you wouldn't mind. We just wanted to know how informative this presentation was on a scale of 1 to 5, 5 being the most informative. We appreciate your time on that. And just want to remind everybody that we will be emailing everyone today with a link to the recording of this presentation where you can watch it on demand, as well as a link to the slide deck where you can download it. So once again, thanks, Layman, and thank you all for attending.